Hi, thank you for tuning in this week. And it's Jackie DuPont, Gerontologist at Vista Gardens today. And I'm on part 2 of the urinary tract infection series. I got so much feedback on the last vlog, so I wanted to go over some issues with you. One was the dipsticks. People had questions about where to get them, and you can get them online, you can get them at a medical pharmacy, you can get them at a DME, durable medical equipment company. They have them too. Another person asked me about where do I get a lot of my information. Well, of course, you know, being a gerontologist, I have a background. However, I really keep up to date with the Alzheimer's disease and other dementias journal, the Gerontologist, and so many others. And they really, really are helpful, especially if you're in the field. Another issue that came up was where to buy the hats. The hats are often at a durable medical equipment company, or you can get these hats at like a brief company that sells briefs. And to update you on briefs, there have been numerous new studies on UTI detection briefs. And the PIXIE, P-I-X-I-E, is one of the most recent developments in preventing UTIs. And what it does show on the brief is a dipstick inside the brief. And it is new, and I'm sure there's going to be other competitors. However, we're still researching the validity, but their studies do seem to be quite promising, so I do encourage you to look into that. Another issue was, what do older adults with dementia look like when they have a UTI? And saying what they look like, you know, they could be pale, they could have a stomach ache like we talked about, they could also lean to one side. And often people will say, oh, it looks like my mom had a stroke. But in reality, she may have had a UTI. So you always want to just rule that out. Could be false, but still rule out the urine and check it. Another thing they may be doing is, of course, pacing, increased behaviors we talked about, lack of appetite, of course, you know, crying, depression, delirium, all that. So really, really don't just ignore that and think it's part of the disease. Really do your best, take them to the doctors, talk to your physician, and really discuss what's going on. Thank you for tuning in today, and I hope some of these UTI prevention and detective techniques do help you.